Good morning! Today, with my partner Daniela Gonzalez and who speaks Tanay Carvajal, we will introduce you to the definition, historical details and origin, causes, symptoms, treatment and prevention of the diarrhea, in order to educate about care and to identify and prevent the severity of this disease. Definition. It is defined as the deposition there 3 or more times a day, or more frequently than normal for the person of loose or liquid stool.
Historical details and origin. In 1681, Anthony Boulenhout became the first person in history to set a microscope, but his interest would not have been such. He not suffering from diarrhea and fecal decomposition apparatus, precisely because of the Boulenhout was forced to examine his own aqueous debris under his microscope. According to his report, he distinguished some very graceful moving animal aqueous, somewhat larger than with the belly provided with several little legs. There are three clinical types of diarrhea basis: acute variety, which lasts several hours or days, and includes cholera. Acute bloody diarrhea, also called dysenteric, and persistent diarrhea, which lasts 14 days or more.
Causes. Diarrhea is usually a symptom of an infection of the digestive tract, which can be caused by a variety of bacterial, viral, and parasitic organisms. The infection is transmitted by contaminated food or drinking water, or from one person to another as a result of poor hygiene. Food intolerance, such as the inability to digest lactose, the sugar in milk, overuse of alcohol or laxatives, medications such as sometimes antibiotic or antacid containing magnesium or menstrual cramps.
Symptoms: watery loose stool, frequent by moving, cramping or pain in the abdomen, nausea, bloating, possible fever or blurry stool depending on the cause, chills, and malnutrition.
Treatments. Key measures to treat diarrhea illness include the following: rehydration. With oral rehydration, saline. The salt absorber in the small intestine and replenish water and electrolytes lost in the stool. Zinc supplement. Zinc supplement reduce the duration of diarrhea episode by 25% and are associated with a 30% reduction in stool volume. Rehydration with intravenous fluid in case of severe dehydration or shock. Consular health worker, particularly for treatment or persistent diarrhea or when there is blood in the stool or signs of dehydration.
Prevention. Can diarrhea be prevented? There are certain behaviors that can prevent acute diarrhea of infection cause, watching how before and after cooking, and after going to the toilet, changing diapers, talking out the animals, or anything, or breathing your nose. Trying out the average, the illness by staying home until symptoms improve, by careful about food safety, goat fruity and vegetal while before eating them, cook egg, my own seafood thoroughly before eating them, breastfeeding exclusively for the first 6 months of life, education on yet and on the modes of transmission of infection, vaccination against rotavirus.
Conclusion. It is important for the population to know about recognizing the symptoms and prevention to avoid serious cases of dehydration and electrolyte loss. Thank you.